Yeah. Yeah. So today, at the Kenya Medical Association headquarters, we have our colleagues from other professional specialists and the dental association. So we are going to introduce them. And this statement is a joint statement issued by both the Kenya Medical Association, the Kenya Dental Association, and the several specialist associations that we're going to name, as well as the Kenya Medical Women's Association. So we will begin introduction from this end, and we will go like this.
Thank you. I'm Dr. Christine Sadia, the National Chairperson of Kenya Medical Women's Association.
Thank you. I'm Mondi Oyo, the National Chairman of the Ophthalmology Society of Kenya.
Where the National Secretary of Kenya Medical Association.
I'm Professor Macligel. You might not get the name right, but
It will be here.
Most of those people on strike are my students. All of them, in fact.
And he's the chairman of the Kenya Renal
Kenya
Association.
Association.
Yeah.
Yeah, Bajaj Andrew, I'm the National Chairman of the Kenya Dental Association.
I'm Dr. Bosiri Wairimu, I'm the CEO for Kenya Medical Association.
And I'm Dr. Jacqueline Kitulu, the National Chair of the Kenya Medical Association, and we are your hosts today. So the Kenya Medical Association and other medical and dental professional and specialist associations press statement on the doctor's strike, today being day 15, a declaration of a national health crisis. On the 7th of December 2016, the Kenya Medical Association, together with the Kenya Dental Association and other medical professional and specialist associations, issued a press statement 2 days after the commencement of the nationwide doctor strike. In that statement, we urge the national and county governments to move with speed to set up a mechanism to engage the doctors on the plan for implementing the collective bargaining agreement signed with the union in June 2013. We also indicated the willingness of the doctors' union to engage in honest and sincere deliberations on this matter, and our readiness to offer resources at our disposal to facilitate these discussions in order to expeditiously resolve the crisis in the health sector. Subsequent to that statement, the KMA National Executive Council resolved that should there be little progress in the talks, or in the event of a declaration of a stalemate between the parties, we would declare a national health crisis and explore alternative means to resolve it. Ladies and gentlemen of the press, we have called you here today to update the nation on the progress towards resolving the crisis and recommend immediate actions to end it. It is obvious to any observer that the public healthcare delivery system has been paralyzed for the past 2 weeks, and there is massive suffering as Kenyans are denied their right to healthcare as guaranteed in the Constitution of Kenya 2010. It is our considered opinion that the key implementers of the right to healthcare are the holders of the executive offices, both at the national and at the county levels. The Constitution requires them to work in tandem to ensure that all Kenyans enjoy the highest attainable standard of health, which includes the right to healthcare services. We hold that this fundamental responsibility cannot be shifted to individual workers, no matter how critical their expertise is. It is the responsibility of the national and county executive offices to plan and deliver healthcare services to all Kenyans. Today, it is our assessment that very little progress has been made in negotiations to resolve the strike and normalize the health service delivery since the 5th of December 2016, when the strike commenced. We are aware that the Ministry of Health and the Council of Governors have been unable to engage the doctors' union meaningfully on the collective bargaining agreement, and the union has indicated that it is not willing to engage outside the framework of the CBA signed in June 2013. In our view, the national and county government's reluctance to discuss resolution of the contentious issues in the CBA and conclude the process to the satisfaction of all parties concerned stands in the way of resolving this strike. In view of the foregoing, the Kenya Medical Association, together with the Kenya Dental Association and the other specialist associations, state as follows. 1. we declare that Kenya is in the throes of a national health crisis as a result of the nationwide doctors' strike that commenced on the 5th of December 2016. 2. This crisis is beyond the ability of any single ministry in the national or county governments to handle effectively, and the response requires coordination by the highest office in the land. 3. The responsibility of resolving this national health crisis lies squarely in the executive office of the President of the Republic of Kenya, who is bound by Article 131(2) of the Constitution to, among other things, respect, uphold, and safeguard this Constitution, and ensure the protection of human rights and fundamental freedoms and the rule of law. 4. We consequently urge the Executive Office of the President to take over any ongoing or planned negotiations and lead the way in generating a plan to implement the CBA signed with the Doctors' Union in June 2013. We issue a categorical warning that any attempts to intimidate union officials or other doctors, individually or collectively, through threats of arrest and other extrajudicial measures shall leave KMA and her affiliates and associates with no choice but to join the striking doctors in any action they may deem necessary to maintain the dignity and honor of the profession as required by the Hippocratic Oath we all subscribe to. Specifically, we note that no negotiations will be possible as long as any of the parties feels intimidated or faces the threat of arrest or other punishment. 7, as always, we prefer the route of dialogue and sincere engagement, and we stand ready to offer our expertise and good offices to facilitate a quick resolution of the crisis. Further, we urge the World Health Organization and the International Labour Organization to take note of this crisis and assist the national and county governments to find a reasoned solution to avert further deaths and suffering among our people. Thank you.